Hello, my name is Ryan Valenciano, and the project that I investigated was the relationship of length tension during different hand grip positions. Muscle insufficiency is the inability of a two-joint muscle to produce a full range of movement along a joint due to it already being contracted or extended. Flexors and extensors of the wrists are two-joint muscles that originate at the medial and lateral epicondyles, respectively. They are often affected by myofascial trigger points, which may be due to muscle insufficiency. Therefore, the purpose of the study was to investigate the effects of length tension relationships in EMG signal across different hand grip positions. It was hypothesized that the EMG signal and force would decrease in shortened and lengthened hand grip positions. There were 8 subjects with a mean age of 26.5 and a standard deviation of 4.84 years. Some of the inclusion criteria included that the participant be able to perform pain-free wrist motion and be able to sit pain-free for 30 minutes. On the other hand, exclusion criteria included no history of wrist surgery and no latex allergy. The experiment was conducted by first placing electrodes over the wrist flexors and extensors of the dominant hand. A maximum grip test in standard position was then performed to achieve maximum voluntary contraction, MVC. Grip tests were then performed in the shortest setting, the longest setting, in maximal extension, and maximal flexion. These tests can be seen in figures 1 and 2. The mean and standard deviations of the grip force and peak EMG were recorded and graphed in figure 3. You can see the overall change in percentage. Overall, the EMG signal and force decreased as compared to standard position. This is in line with previous research, which has suggested that when the phalanges are flexed, there is a decrease in wrist extension, leading to passive insufficiency. Instead, they are used as stabilizers. This is evident throughout the experiment as the wrist extensor EMG decreased. These findings can be implemented to help prevent overstraining of muscles. As suggested by the findings, exercise and use of tools should be used with minimal extension to maintain muscle force and prevent injuries. This also brings attention to sports that emphasize strong extensive movements, such as tennis and golf, which should be practiced with slight flexion to prevent injury. Thank you for listening to my presentation, and I'll see you again next time.